Hi, everyone. It's Dr. Ozzy here. Welcome to the More Than a Pretty Face podcast. Hi, everyone. I'm so excited for today's guest, Dr. Christopher Asandra, a hormone specialist. And this is such a hot topic. I get so many questions about hormones in the skin, hormones in aging in both men and women. So I'm so excited to talk to you, Dr. Asandra. How are you?
Good. It's such a pleasure to be here. Thank you for having me.
So what do you specialize in? Is there a specific, hormone or branch of regenerative medicine
We call it functional medicine or
functional medicine? Okay.
aging medicine. But yes, it's kind of similar to endocrinology, but I think we kind of take a more personalized approach and a very in-depth approach to patients based on their blood work, their hormone levels, et cetera. So we're constantly checking these types of things all the time to make sure everybody's balanced and feeling well.
So a lot of people, are dealing with skin issues and hair issues.
Yeah.
And somebody who, for example, having some hair loss, and what hormones do you really look at closely, and what are your latest sort of major findings with that?
Yeah, I think, that's interesting. Ever since COVID, as well, as we're seeing a lot of people with hair loss. A lot of people are losing hair after COVID, et cetera. But, we do check a lot of things, and it's important to not just, throw a treatment at everybody, but to kind of look at the entire body itself, look at the blood and look at the labs and see what's going on. For example, we have a lot of hypothyroid or low thyroid patients that come in. And,
from COVID, you feel like, is it an effect of COVID, or is it just?
I will say the COVID, so this is interesting. You brought that up. I've checked a lot of people's hormones during COVID, or if they've had COVID or during COVID, and COVID seems to plummet everybody's hormone levels. For example, when I had COVID, I decided, hey, I'm going to check my testosterone levels, and it was at 34, my total testosterone, which is very low. I mean, the normal range is somewhere from like 250 to about 1,000, and I was at 34. So I think a lot of these things cause it or stunt the hair growth, et cetera. But we did see a lot of that happening there, just imbalances of different hormones with COVID.
So aside from testosterone and thyroid for hair loss, what other markers, should people pay attention to?
I think you have to check iron levels. So in a lot of my vegan patients, they tend to have lower iron levels. And as we know, low iron levels can cause some hair loss as well. We also check DHT levels in our patients too, to see it, which is the byproduct of testosterone. And if someone's converting a lot of that into their testosterone into DHT, that could be also an indication of why they're losing hair. And then, we also see a lot of patients with PCOS or polycystic ovarian syndrome. These ladies have excessive amounts of androgens or the male hormones in the body. And we have to try to suppress that or counter it with certain medications and supplements to kind of keep their levels more stable so that they're not losing a lot of hair. And then, people with low thyroid, you want to replace that safely and without giving them a lot of the side effects, but also improve their nutrition, the iodine, selenium, and the vitamins to try to make their thyroid more healthy overall.
So, yeah, it's interesting, there's a lot of supplements. And do you also do IV, like hydration, or not hydration, but, I hear about NAD, for example, in IVs. Is that something that you believe in or offer, or?
Absolutely. I think.
Yeah. What is your take on that? Yeah. What is your take on that?
I think it works. I've had patients swear by it. I use it myself. I take a supplement every day for it. A lot of my patients will inject it daily as well, or they'll do like an IV of it initially.
So tell us, a little bit about that. What is NAD?
So NAD
why do people do that?
Right. So if you look in the mitochondria, the energy producing part of our cells, NAD is a crucial component to producing energy. And as we age, all those levels start declining. So that's why we don't feel as healthy. We have the brain fog. Our immune system goes down. We don't feel as energetic. And by replacing the NAD, it really helps kind of rejuvenate people. But we also use it for detox too. So a lot of patients who are addicted to alcohol or other types of opiates or drugs, that it tends to reset the brain and receptors and kind of help them. And there's a protocol for this to kind of help them get out of that. But a lot of people do it for the anti-aging purposes. And more people are just, they're doing a little bolus of an IV and then they start injecting it daily. And a lot of my patients just love that. They say it gives them a lot of energy. They feel more youthful. Their immune system is better, and they don't have to drink as much coffee during the day.
I see. And what about growth hormones? Because that's another one I hear about, whether that, there was a recent article, well, not too recent, maybe a few years ago, that looked at growth hormone in combination with metformin, since growth hormone can give you diabetes, right? So they also started people on metformin, and it was a small study, and it was mostly in men, right? Do you know which one I'm?
Yeah, David Sinclair, I think he kind of did that whole thing with growth hormone, DHEA, and the metformin and all that. And they looked at the thymus and all that, the cells there, and they saw some reverse aging of that. Growth hormone, I think, is good, but it can be tricky to use. I personally don't use HGH in my practice, but what we use now are the peptides. You've probably heard a whole bunch of stuff about peptides, which are a string and combination of amino acids that kind of stimulate the body and your cells to produce more growth hormone versus actually injecting exogenous or foreign sources of the hormone. And that really helps people feel younger. It helps with hair growth as well on their skin. A lot of ladies tell me their skin feels tighter with that. And they notice more muscle growth. They get better sleep, etc. So I almost see it as kind of like a growth hormone, not the alternative, but a better form of it because it's safer. You can use it long term. And then also that it doesn't cost as much as well. I think a lot of times HG just cost prohibitive for a lot of people there. But I can tell you this, a lot of people do feel younger with that when they combine it with the metformin, when they combine it with hormone replacement therapy. It really changes the body, but it also changes the mind as well, I think, for a lot of people.
So it sounds like you're giving them the building blocks to make their own internal growth hormone.
Absolutely. And I think that's a safer way to do it, to tell the body to kind of produce it itself versus, taking some sort of, artificial growth hormone itself.
So, I have a lot of female patients and followers that, ask me about hormone replacement as they're approaching menopause, and some of them may be in menopause. And I've read recently some of the guidelines are changing in terms of HRT, hormone replacement therapy. Before it was a big controversy, shouldn't start estrogen or progesterone. There's all these risks and don't do it. And it really deterred women from even seeking, help for some of the symptoms. But now I'm seeing recent studies that say, well, it's not as bad as, we think, and it's not as bad as we thought it was. And so tell us a little bit about, like, if you were a woman in your late 30s, early 40s, what would your approach be? Because you got to start before you hit menopause, which usually is in the 50s, right?
Yeah, and I think we're seeing it earlier and earlier now in a lot of females, males too, that their hormone levels now compared to, let's say, 30 years ago, in terms of, like, if you took a 40-year-old person now or a 50-year-old person now compared to 50-year-old 30, 40 years ago, their hormones are definitely decreased. I think a lot of the controversy and the fear came from that Women's Health Initiative study, which is a very flawed study that was done in the early 2000s, where they were giving women equine-derived hormones, Premarin, which literally means pregnant mare's urine, Premarin.
So from horses.
From horses, right? So women were having strokes and breast cancers and heart attacks, all this stuff. And so they were dying. And I think that kind of stuck with it. But now we've kind of evolved to the bioidentical hormones, which means that it's the exact same molecule in the body, one for one. We're not using equine derived. We're not using synthetics. Even birth control is synthetic. But if you replace it one for one, we don't really see that. And women's quality of life, not only do they feel better, but it's actually a lot safer for women to use now. But I am seeing people now kind of, the hormone levels are definitely lower for people these days, especially in their, sometimes men and women in their 30s. You're like, how does he have a level of like a, 60, 70-year-old? And it could be our product, our environmental factors, diet, lack of exercise, more stress. I think we have now with social media and everything bombarding us left and right. But like you said, we kind of want to start it early when they first start feeling those symptoms to keep them out of it and alleviate some of that. If someone has a hysterectomy early or whatever it is, that can be devastating for a young woman to go through that and not have any of the hormones, not just for her, but for the people, her people around her, her partner as well. So it's important that we replace it safely, we monitor it. And I think it's really kind of evolved, like you said, with all the recent studies that, I've got my own mom on it. She's 76 and she feels like she's 40. So,
So tell us, what like what symptoms should women look for? And when should you say, okay, I think it's time I need to check my hormones just to be sure? Like you said, our hormones are different than they were 30 years ago. And I personally do believe a lot of it is the rise in cortisol and stress that goes along with it. But what symptoms would you say, or kind of telltale signs that something's not right?
Yeah, I think for women, a lot of times they'll tell me the main thing they tell me is fatigue, brain fog, low libido, lack of energy. They don't have the motivation to do what they want to. They struggle to get themselves to go to the gym or exercise. And even when they do, they don't see the results that they used to. And then some women are suffering from, vaginal dryness as well. Intimacy is hard for them, or they just don't even think about, I think having a healthy libido is a good sign that you yourself are healthy. But also the mental parts, the depression, the brain fog, something triggered it. It's something they're just not feeling right anymore. And I think that's key to really watch out for those symptoms. And then, you could go to your regular doctor and they're going to check your levels. And I don't really believe that, like, okay, you have this range of hormones, but if you're at the bottom of the normal range, that may not be, it's a lot of it's subjective. You may be at the bottom, but I believe in being at the middle of the top part of the hormone range, because a lot of times when you're at the bottom, everybody's different. You may feel, if I have a testosterone of, let's say, 500, to me, that's not where I operate at. I operate at around 1,000. That's where I feel best. That's where I feel most energetic. So you've got to really look at the individual and treat the patient, not always just the number for that.
So it sounds like you rely on symptoms more than the number per se.
I think the numbers are good for baseline to kind of see where they're at. And a lot of times their number will reflect their symptoms sometimes. But I think, we're under a lot more stress these days. Our cortisol levels are higher, where we have to do a lot more things. Sometimes I think you have to be optimized, as I call it, and be towards the higher normal range of like, say, your thyroid, et cetera, in order to feel, quote unquote, normal again, or feel like yourself again.
So if somebody comes to you and, they're sort of having these symptoms, is there a panel that people should ask for when they go in to see their doctor? Or is there, certain times? Because I know hormones fluctuate, right? So they're not always the same level. So what if you catch your hormone when it's really high and it's falsely high, or really low?
Good question. I think, for menopausal women, I think it's kind of, I don't think you're going to really catch it because they're not really producing those hormones anymore. But I think for, women who are still having their menses, I think, we want to test it somewhere on day 19 through 21 of their cycle, which is going to be most accurate depiction of where their hormone levels are at. It can fluctuate as well, like you said. That's why it's important to monitor. But most of the time for women who are perimenopausal or menopausal, it's pretty much, the same all the time because her ovaries aren't producing much anymore. But to your original question, what you should ask for, even if you ask the your regular doctor for, can you check my hormones? I think 90% of the time, they're really not going to know what to check on you. That's why it's important to go to a specialist where they really dive in depth on the actual hormones themselves. We want to check an FSH, follicle stimulating hormone, DHEA, progesterone, estradiol, testosterone, and even the thyroid. You can't just take TSH like a lot of doctors will do. Oh, your TSH is normal, you're fine. I think it's important to check the free T3 and the free T4, which is the actual hormone that's floating around in the body and the active form of it, to see if that can be optimized. Because sometimes I find people with very low T3 and T4 levels, but their TSH is normal.
Yeah, I agree. I think sometimes you have to look beyond those screening levels to get a more accurate picture.
Absolutely.
And so, PCOS, that seems to be a big, topic, a big issue for a lot of women right now.
Yeah.
Can you have normal hormones and have PCOS? What is it by definition? What is the sort of the criteria for PCOS?
A lot of women come in and saying, I have PCOS. My doctor just told me. And I'm like, how do you know that? He said, well, based on my symptoms. He said, I have some facial hair and acne sometimes, and I'm gaining weight. I'm like, but did they actually check your hormones levels? And did they actually see elevated androgen levels in you? Well, no. That's usually the response I get. And if I check it and I see that their testosterone is higher than normal, their DHEA is higher than normal, then I kind of know, or they have some glucose intolerance, et cetera. Or I think it's also important, they can diagnose it they actually had an ultrasound done to see if they really have all these cysts on their ovaries, et cetera. So I think sometimes it's a diagnosis of just based on symptoms, but I think it's important to confirm it with the actual lab test to see that they have higher than normal testosterone levels, et cetera. Or an ultrasound to see if they really have a lot of cysts on their ovaries.
Hi everyone, it's Dr. Ozzy here. Happy September. Fall is almost here, and so is the time to transition your skincare routine from summer to fall. For our podcast listeners only, we're offering 20% off our best-selling moisturizers, Intense Recovery Complex and Restore. Get your moisturizer in time for the upcoming season with our limited time promo. Take 20% off at checkout on OzzyMDSkincare.com with code September20. I love to see your skin transformation, so tag me in your stories and post on Instagram at Skin by Dr. Ozzy and show me your skin transformations with OzzyMD Skincare. And then lastly, I see these glutathione clinics and people doing glutathione injections. And what are your thoughts on that? Because that seems to be kind of controversial. I personally want to know about it in terms of skin lightening, because a lot of people come in and they want, for whatever reason, especially in the Asian or Middle Eastern populations. And what are your thoughts on that?
I don't personally use it for the dermatological part of it to lighten skin. However, I do use it for, people always request it to be in their bag after, they've had a long weekend or they partied too hard over the weekend and they, it's kind of a way to detox them and make them feel better. So we will use it in some IVs for that. But as a skin whitening protocol, I'm not familiar with that at all.
So not something you do.
No, definitely not.
All right. Well, we're going to finish up with some rapid fire questions so that everybody gets to know you better. Right. You ready?
I'm ready. Let's do it.
All right. So you go to Starbucks. What do you order?
I don't drink coffee.
Oh, wow.
But if I did go, I would probably order a tea, a green tea or a matcha tea. Yeah.
Uh-huh. And then what about, so you don't do procedures, but what's your favorite sort of rejuvenation treatment that you offer?
So we do the bioidentical pellets, the hormone therapy.
Oh, okay. Yeah. Tell us about that.
Yeah, that's our biggest thing here. So that we probably, I do 20 to 30 a day on average. And all those are based on what they need, if they need more estrogen or testosterone, et cetera. But that is my favorite procedure because you see the effects of it pretty soon in the patients and they're just like, they're alive again after receiving that for men and women. Yeah.
And where do you put the pellets? How does that work?
Two places. We can either put it usually in the upper buttock area in the fat. It goes right under the skin, into the fat there, no stitches or anything. There's size of a rice grain for women. And then for men, it's the same thing. But sometimes, ladies are self-conscious about having a procedure in that part. So we'll kind of do it in the growing area. I've done that a lot for people who have like to expose their, backside a little bit more.
And then how long does it last? How often do you have to go in to do the pellets?
Women, it lasts about 3 months. Men, 4 months. And so I think it's just because the actual physical part of the pellet is smaller in women, and then they use a larger one. So it tends to dissolve a little bit over time, a little bit longer. But it's also dependent on your activity level. So the more active you are, the more you're working out, et cetera, you're gonna chew through that or burn through that pellet a little bit faster.
I see. And then are these bioidentical hormones that are in the pellets?
Yes, they're bioidentical. 100% pure testosterone, 100% pure estradiol.
Mm-hmm. So testosterone, estradiol, do you do progesterone? What other hormones are given via pellets?
Progesterone, we don't want to use as a pellet because it makes you sleepy. So we usually have them take it at night before bed and helps them really get good sleep, but also helps balance the estrogen as well. Mm. So progesterone, they used to make a pellet for that, but it's kind of fallen out of favor because if you put that in 3 months, you're kind of sleepy the whole time.
Oh, really? Huh.
Yeah.
Okay. Yeah. I didn't realize that. I thought progesterone gave you energy because it's similar to testosterone, but I guess not.
Yeah, it definitely helps relieve anxiety. We use it for a lot of postpartum depression too.
Oh, really? Huh?
Oh, yeah, because their progesterone levels crash as soon as that placenta comes out. It's not producing progesterone anymore, and the body doesn't restart making it. So I use that and gets them out of it like that without having to take any antidepressants or SSRIs.
Oh, wow! I didn't know any of that. That's awesome.
Yeah.
So, what is you? We don't drink coffee, but what's your guiltiest?
Guilty as pleasure desserts for me.
Desserts. Okay.
I do enjoy a sweets here and there.
Do you have a favorite dessert? Is it cookies? Is it cakes? Donuts?
Chocolate chip cookies, cupcakes, cakes. Yeah, ice cream. That's my weakness. I'll try to take a couple bites and stop, but sometimes I can't help it.
Yeah, I love the ice cream cakes, I have to say.
Oh,
those are some of my favorites.
Don't remind me.
And then do you have a cocktail of choice?
I don't really drink alcohol either.
No caffeine, no alcohol. You're uber healthy. You preach. You do what you preach.
Somewhat. I don't mind. I think alcohol's okay in moderation, but for me, I'm Asian, etc. I just have a bad reaction to it. I get sick, and I don't turn red, but I get sick off of it. So not my favorite thing anymore. I usually just grab like an energy drink or something, probably just as bad for you. But I like to feel more energized than I like to do feeling, depressed.
Right. Yeah, it definitely can slow you down. But
yeah. Definitely.
Well, it's so great connecting with you and, learning more about this other part of medicine I don't really know much about. So it's you brought up some really great insights, and I think your vision of treating the whole patient as opposed to just the levels and, just giving out prescriptions. I love that. And I think that's so important to be patient advocates and really see them as a person and not just as a case study and so forth. So
absolutely.
And then tell us a little bit about how we can find you. How can people find you? Tell us where your clinics are.
Yeah, my clinic is in Beverly Hills and then one in Newport Beach to serve the Orange County area. We can also do telemedicine consults. I usually say just go to the website, AsandraMD.com. My Instagram is the exact same thing, AsandraMD. You'll see that's really the best place to find me. And feel free to set up a consultation and we'll get you started.
All right. Well, thanks so much for joining us.
All right. Thank you for having me.
Okay. Take care.
Bye-bye.